Hello, welcome to Ask an Expert Friday. I am so excited for this episode today. I'm Stephanie from our Beauty Referral Network, and I have Allyson here, who's a nutrition and advanced esthetician. And we're going to dive deep into what she does and how she helps people and why she got started. So our Beauty Referral Network, we are a network that helps beauty and health and wellness businesses thrive by connecting them with clients. Our whole network is based off of referrals and collaborations, and it's super fun. So if you want to come and join our network and come take a look at what we've got going on, our Facebook group is free. And then we have our VIP membership program that I can also link into the captions below. So Allyson, do you want to introduce yourself and tell everybody who you are and what you do?
Yeah, so thank you for bringing me on this morning. This is super exciting. As Stephanie said, my name is Allyson O'Brien. I am a clinical esthetician and soon to be nutritional counselor based out of Surrey, BC. I also specialize in oncology aesthetics. I have been the educator for Oncology Training International for the last 3 years, 2 years now. But I have been trained as an oncology esthetician for the last 12 years. So I deal with a plethora of skin conditions, anything from acne, rosacea, high risk skins to obviously working with cancer patients on their journeys. I'm also a kind of a Jill of all trades, and I'll just kind of give some of my certifications, but I'm also a lash extensionist, a laser tech, and God, what else am I? Oncology esthetician, nutritional support, things like that. So lots and lots of different certifications that I have in my back pocket. And then once the nutrition is done, then I'll be an oncology nutritionist as well. So
Fun. Can you
yeah.
tell everybody what an oncology esthetician is?
Yeah, so it's essentially a certification where you are certified to work with cancer patients during their journeys. It's typically just a modified treatment that you provide to the client at their time. So if they've got, let's say, a port inserted, how to properly work around the port, dealing with these different skin conditions that can occur due to chemotherapy. Um, when it's kind of becoming induced skin condition, if you want to say, how to work with the lymphatic system properly, because anyone throughout their life who has had lymph nodes removed is prone to lymphedema. So it's making sure that we are ensuring that the lymph does move to either the opposite side of the body if they've had lymph nodes removed, let's say under their one arm, and ensuring that we do allow it to drain so that we're not causing lymphedema issues within their system. So pretty fun, pretty rewarding as well, but it's just an added certification. So it's something that I get to do. I actually just worked with a cancer patient yesterday. So she was
Cool.
very lovely, and she's going through her journey for breast cancer as we speak. So it's been it's been good. So I'm cheering her on from the sidelines and making her skin glow. So
Awesome.
yeah.
Awesome. So that was an added on certification. So you were an esthetician first?
Yeah. So I've been an esthetician since 2005 I graduated, so over 20 years now. I think I'm coming up to my graduation date. Actually, it would have been April, so 20 years tomorrow, or next month, I'm sorry, I'll be an esthetician for. So basically been
Yeah.
at it for like the last 21 years, essentially, if I started school back then, but fell in love with it long time ago. Back in high school when we had cosmetology, and that was the only thing I wanted to do once I figured out what it was. I Before that I wanted to be all kinds of different things: a tornado chaser, a nurse, a paramedic, a psychologist,
Hold on. A
marine
tornado
biologist
chaser?
was a sorry, yeah. Yeah, I guess
That's interesting. My
Twister
kids actually,
inspired me.
that's funny. My kids actually love watching the tornado chasers on YouTube.
Oh, do they?
I
Yeah, I
can't tell
was
you how many
really.
I've seen now. And I'm like, that is scary.
Yeah, that was one thing I think Twister, like I said, inspired me. So it was hilarious to kind of, I think the biggest one was marine biology, and I kind of had my goals set on that and things like that because I love the water, and I still love animals, and things like that. But then like I said, we had cosmetology class in high school, and start skipping other classes to go and sit in cosmetology class. And
Yeah.
my teacher came up to me one day and she was just like, Allyson, like, you love this class. And I was like, well, duh. And because, typical 17-year-olds, like, we know everything type of thing. And she's just like, cool. So if you don't become an esthetician or a makeup artist, I'm going to fail you. And I was like, you can't fail me. I have 98% of the class. She's like, exactly. So, typical like ego as a teen, you're like, whatever. But it clicked. And yeah, just completely fell in love with it and got involved with designing makeup for some of the plays that we had in high school and just built from there and just kept going with it.
Oh, that's fun. I never had that opportunity to do that in high school, but right after high school, I actually went to makeup school as well. So
Oh,
a
cool. That's
makeup artist and
awesome.
hairstylist. I never did like cut and color and all that stuff, but
Yeah.
styling for events and things.
Oh,
But
nice.
I started getting interested in high school, but I never had that opportunity to take any classes in high school. So
I think
interesting that
there
you
is
got
in
to.
our region in southwestern Ontario. I was in
Oh,
Cambridge,
in Ontario.
Ontario, and they had, there was like us and like one other school about an hour away that both had the
Oh,
cosmetology
okay.
class. I think things like that, especially with the arts and these alternative classes like auto and cooking and all these, are so
We had
important
that.
for kids. Yeah, so
Yeah.
important. But yeah, I totally fell in love with it. There was actually a couple of us who have been pretty successful at what we've done, so it's been a really rewarding to like watch all of us grow up and like kind of do what we want to do and things. So
It's
it's
fun.
been fun. Yeah.
Yeah. Cool. Excuse me, everybody. Been suffering a cold as of yesterday, so my voice doesn't sound the same. My nose is still a little bit leaky, so ignore me. Um, okay. So yeah, that's quite the journey. I wish I had that opportunity to learn some of that in high school, but I
Hmm.
went to school after that, and it was almost 20 years ago now too, actually. It would be 19. This year is 19 years.
No, perfect. Yeah,
19 years.
I graduated in '03, so it's been a few years.
Yeah. Awesome.
Yeah.
Um, Talk to me about the nutrition side then. So what got you into nutrition? Because aesthetics came first. So what got you to go into nutrition?
Yeah, so the nutrition side was really something that I discovered probably about 8 years ago. Obviously, it's always been part of the skincare thing, some things that are aggressors towards certain skin conditions that can occur. So it's always been kind of in my scope, but not to the extent of obviously where I'm going to be now once I've completed it. Um, I was had actually brought, I'm a weight loss coach with a keto program as well, that I had a certification in, and that was kind of the start of it. And at a conference with a bariatric surgeon and just listening to her and the different conditions, skin conditions that she was also talking about with certain people dealing with obesity and all these other things. And that was kind of the tip of it. But then there was also, I had all these 40 and 50-year-olds coming in going, Ali, I have like so much acne right now, what's going on? And a lot of it was hormone changes, which we know obviously in the 40s is a big thing, and also foods. So I worked really closely with naturopaths and their physicians and things like that to ensure that we had allergy panel testing and food panel testing to see what it was, so that I could deal obviously with the outside part of it. But there's such a link between gut health and skin health that some people don't really see. So I think it was really just a really good tie-in to bring into what I do and kind of mixing that combination together. And then obviously with the oncology aesthetics, the oncology nutrition would be really good too, because I find sometimes when people, not just cancer patients, but people when they go to the hospital, they basically essentially get like a tear off sheet. Oh, you've got diabetes type 2. Here's what you're going to be like. This is your suggested foods to kind of stay with. And I think that it's more of just an education and understanding. what you can really do with natural fresh foods. Yes, I know you're going to have the Big Mac, but just don't do it 3 times a month. Do it every 6 months, right? As a treat type of thing. So I think it's just more of an education thing, um, to be able to provide to clients and also give them kind of a little bit of a backup on the favorite foods that they have and how can we kind of change it to, number one, fix their skin or their gut, and number two, how is it going to affect them in with the condition that they're going through at this point. So that's kind of how I was looking at it, and just comboing it together, because gut health is super important, as we know, and all the research and studies that keep coming out, and just really ensuring that everybody's kind of, keeping optimal health and, the longevity of their life, and not being in, pain, or, you know, having arthritis show up early because of their inflammatory markers and all this other stuff. So I think that's a really big important thing. Um, and it's also helped me as well with some of the injuries that I've gone through. So it's been, I think it's been really helpful that way with bringing it all together. So I'm pretty excited about it. I'll be done by the end of this year.
Okay.
Um, so yeah, it'll be good.
Okay. And like you said at the beginning there, they hand you a piece of paper and say this is the foods to eat. I mean, it's different because everybody is different. So you really
Hmm.
need to customize that because there's so many
Yeah.
different methods to eating. There's also eating to your blood type.
Yeah.
So just because this food is deemed healthy doesn't mean it's healthy for you either.
Hmm.
Because as you said,
Hmm.
it could be causing inflammation or anything else going on in the body.
Yeah.
So going a little bit further and talking to professionals like yourself and like the people that you work with is going to get people much, much better results in the end.
Yeah.
The people that I find that everybody that has like acne and skin conditions, they go straight to skincare and topical treatments and
Hmm.
forget that it's actually coming from within. Like you need to
Hmm.
solve what's going on inside before
Hmm.
the outside will heal. You can put anything on your skin and it might temporarily help or relieve
Hmm.
whatever the symptoms are, but they're not going to go away with skincare alone because it's an internal
Hmm.
issue. It's your body telling you something's wrong and it
Hmm.
comes out through our skin. I think a lot of people just
Yeah,
don't
and
realize the systems
that's
work together.
yeah. Yeah, it's definitely prevalent in most cases. There are, typically something, but there are also cases that you are very correct in what you're saying, but there's also cases that it's just a skin thing as well. But
It could be.
in order to bring down that inflammatory response, is also making sure, like you're saying, like the guts kind of balanced in terms of what they're doing. I think there's so much information out there with people that it's really hard for people to, Google, like one Google page will tell you one thing and the next Google page will tell you another thing, right? So I think it's
Yeah.
it's really important for every professional, no matter what they do, to people to understand that we're here and we've done the schooling and we've done the research and things, so they're not going to have to get lost in the,
Yeah.
trillions of pages of.
Endless Google search. Yeah.
Yeah, yeah, because people go down rabbit holes, and it's definitely, one of those things that I think it's just kind of breaking down those steps of, like you're saying, like, is it a gut health thing that's showing up on their skin? Is it a hormone thing that's showing up on their skin? Is it, like, there's so many factors that play into skin and how skin is. So yeah, I think it's super important with what we kind of look at and achieve and everything else. So yeah, for sure.
Yeah. Yeah. So when you realize your topical stuff isn't working, then that's time
Yeah.
to go internal.
Yeah, absolutely. Absolutely. And I think that's where it is good to have people like dietitians and nutritionists and naturopaths and, all these other things. But I think it's also, self kind of care is the one of the biggest things too, is taking down that stress level, taking down your cortisol levels, right? Like, it's those are going to be huge things, and helping that response of that fight or flight going on within the system, and just getting out and walking, just to really help change how your body system is working at that very moment. Even something as simple as that can help the skin. So I
Yeah.
think it's really important that people kind of get back to nature, and, really tie in. I really feel that Western medicine and Eastern medicine really combo very well together, and they're both absolutely needed because some people, the full natural route just doesn't work.
Mm-hmm.
And that's okay because a lot of the Western medicine stuff comes from nature as well, right? So they really have to have that nice combo of both to ensure that we're getting the best results for everybody at that point, right?
Absolutely.
So yeah, I think it's a really I'm really excited about it, and I'm hoping that it'll go well, and it'll start to kind of give people a little bit of that more of that understanding of they're not alone in trying to figure out what's going on, right? So
Yeah. So
yeah.
with the aesthetics, what's your favorite service to do that you provide?
Oh, probably dermaplaning is probably one like my favorite facial. Or comboing it with the Oxygeneo superfacial and dermaplaning, just that
Okay.
like glass skin look. But ultimately, Stephanie, I think it's like all of it. It's all of it together. It's just that skin transformation that I love. I had a lady in yesterday. We've been doing a bit of some peels on her and some IPL on her and things like that. And her skin, just looking at the before and after, was just like a huge stark contrast between the two. And I
Cool.
think that that's kind of one of the reasons why I get to get up every day and do my job, is because I get to help people feel even that little bit better about themselves. And people don't a lot of the times look at their skin and realize that it's changing until they see that side by side comparison on stuff,
Yeah.
right? So that makes me excited. But definitely dermaplaning is probably one of my top choices there for sure, to in order to give that really beautiful complexion and things like that. So
Okay. What are
yeah.
what's the most common skin concern that clients come to you with?
Acne.
Acne. Okay.
Yeah. Yeah, acne, like minus the cancer, but acne is probably the skin condition most, and all age ranges. Like I was kind of
All
saying
ages.
before, touching base on, teenagers going through hormonal things, and then adults going through their hormone changes, right? So it's definitely that it's prevalent with everybody, but again, it all comes back to a lot of the times it's very big play on just your hormones and your body changing. So
I
it's just
realized
having.
mine was my hormones. I suffered from a teenager into like my mid, almost late 20s.
Yeah.
It was really bad. I still
Mm,
break out a little bit, but not nearly what I did before.
yeah.
Especially recently, I'm much less now that I've kind of figured out a few things, but it was
Good.
definitely a hormonal thing for me. And everybody I spent thousands of dollars on treatments on my skin,
Yeah.
and not one person was like, "Oh, maybe you have an issue internally. Maybe we should, address that."
Mm.
So
Aw.
it was a little annoying that nobody had said that to me. I had to figure that out on my own.
Yeah. And I think that's the thing, is estheticians are evolving all the time. And our basis is skin. And when you're going through school and things like that, obviously with any job, you get the basics of stuff. And they don't really teach you about that internal aspect of things, right?
Yeah.
I've had a very privileged career where I've been able to work with naturopaths and doctors and derms and um, aesthetic injectors and all kinds of people, nutritionists and like Eastern medicine therapists, things like that. So I've had that ability to really play off of all the knowledge that they've also provided as well, on top of my own research and all of that. So I think it's super important that like I said, they all play into one another.
Yep.
But you also have to self advocate, kind of like you did. Is sometimes estheticians don't have the background like I do, or the understanding and the knowledge like I do. I think it is becoming more and more of a thing.
Yeah, I
Um,
think so.
yeah, but I think that, and that's okay. They don't need to have that necessarily in their scope of practice, because they can always send you off to someone else. If it's not working, let's figure something else out, right? And that was kind of where I started with that was, let's go get your foods tested. Let's go get your hormones tested, because we know as estheticians, hormones play a big part in the skin, right?
Yeah.
So it's just having that arsenal of people behind you,
Yeah.
and you're better with a team, no matter what industry, that you don't have to know everything, and that's okay. And having someone that does know a different scope of it, you
Yes.
guys are able to pair up even better with that, right? And
I
I
was just,
still to this, I learn stuff all the time, still to this day, and I've been doing this 20 years, right?
oh
So
yeah, totally.
yeah,
Totally. I was just gonna say, like, yeah, collaborations. Like, you don't have to know
100%.
everything yourself. Just
No.
find somebody that does know the
Yeah.
stuff that you don't know and partner up with them
Yeah.
and create a
Yeah.
beautiful collaboration together.
Yeah.
Like, you
And
can't specialize in everything. You can't do everything
no.
because, like, once you start to know too much, it kind of gets a little foggy. Like, there's just so much going on in
Yeah.
your head. It's better
Yeah.
that you focus on what you're really good at and partner up with somebody else that's really good at
Yeah.
the other thing that you're missing that can help your clients even more.
Yeah.
Then everybody gets service a little bit better.
Yeah, absolutely. And I think you're better off as a professional that way too, because I
Mhm.
find that those some of those people who try to know too many things, it also starts to affect their credibility on what they're doing as well. So, like I said, is mine is kind of that all over health. My business kind of motto is like the four pillar stones, which is a pillar stones are kind of a Celtic stones that you'll find throughout Ireland and Scotland and things like that. But I kind of look at them as the four pillars of health: is self health, wellness, and beauty.
Yeah.
So taking all of those structures and making sure you're applying them to me, putting them towards my treatments, and also ensuring that my clients can put it towards their kind of day to day type of thing too. But I think self advocacy and doing the research too, I think is important. But getting back to the professionals are here to help you, and making sure, because like I said, we have gone through all the schooling, we have the knowledge. And Google's a great teacher, but it's not always right? So
No, yeah, you could spend a while going down the Google rabbit hole.
yeah.
Yeah, yeah, like I'm also an herbalist, so that I've kind
Oh,
of
cool.
yeah, I swapped from I'm a retired makeup artist basically,
Hmm.
so I don't do that anymore. I still have my team in Vancouver, but I took an herbalist course back in I can't remember exactly what year. It was like 2012, 13 or 14, somewhere around there.
Hmm.
And I kind of started making some things, and then when I moved away from the Lower Mainland, I stopped doing it for a couple of years, and then I just got back into it. But I've
Oh,
always
good.
specialized in the immune system
Yeah.
and helping people with like preventing colds and flus, or at least reducing the amount of time they're sick. Like I just got out of a 1 day cold. Like how many people go through a 1 day cold? Most people
Yeah.
complain that they're sick for like a week straight. Like I know I still sound like I'm sick, but I feel like 1,000 times better than I did yesterday. I can actually
Yeah.
go about my day as normal again, versus before. So yeah, I started helping people with their immune system, and I wanted to go into like gut health as well because they
Hmm.
go hand in hand together.
Hmm.
Like I'm not going to go into like a totally different system that has nothing to do with this because that just doesn't make sense. As you
Hmm.
were saying, like stick with my lane.
Yeah.
I'll probably end up partnering with people that do other things and nutritionists that can combine a bunch of food and stuff into it as well. But
Hmm.
I love helping people with their immune system.
Yeah, no, that's awesome. Herbalists are really important. It's obviously something that's newer to me, but I have worked kind of in collab with a couple of them in the area, and they're just the knowledge they even have on things. I'm like, oh, I didn't know that. Like, and that's
Yeah,
that's okay not to know something. I think that's one of the biggest strengths you can have, is that
I know.
you don't it's okay not to know everything,
Like I
you
want to know
know?
everything, and it's like one of my biggest struggles is I'm such an education junkie that I'm like, oh, I'll take
Yeah.
this course, I'll take this course, and I have to like stop and be like, no, I need to focus on this.
Yeah.
Because I'm like, I'm gonna go
Yeah.
take a nutrition course, I'm gonna go do this, I'm gonna go do that, I'm gonna learn all these things. I'm like, no, 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 I should just focus on my herbal stuff.
Yeah, no,
It's simple.
herbalists, I think it's definitely undervalued, I think, because there's so many things that you can bring to the table as well, with like the matching, like I was saying, that Western medicine, and also bringing in
Yes,
that Eastern medicine aspect of stuff. I think it's super
herbal
important to be able
medicine.
to have that.
For sure. What skincare myths do you hear the most often, and how do you address them?
Oh God.
I know, it's a really good
Um,
question. There's so many.
yeah. Oh, that chocolate causes pimples and
Oh
acne.
my God, yes.
That's one. There's so many things right now because it's like TikTok right now is kind of that like Google for
Oh,
skin, and it just
fuck.
it it drives me crazy because even with my my one younger client that I had gone off of her birth control after only a year of being on it because it was helping her with her acne, but because someone was telling her on TikTok that it was gonna cause her infertility and all this other stuff. I
Oh
think it
my
was
God.
like just little things like that, and I honestly I kind of I was my reaction was a little. I was like, no, that's insane. But anyway, I digress on that. But I think different foods, I think is probably one of them. I eat too much chocolate. I eat too much sugar. I eat too much this. I eat too much this. It's causing my issues. No, it's inflaming the issue. The
Yeah.
issue comes from your cells not being happy, right? So, yes, are you adding to your inflammatory response by eating chocolate? Yeah, probably. Is sugar causing excess aging? Yeah. I think the other thing is too is like is on the cancer topic is people thinking, too many again foods are causing my cancer. Well, no, it's a whole cellular network of cell death that's happening. Is your lifestyle not great? Is it aggravating the issue? Yes. I think that's probably the number one thing. Um,
Do you remember that commercial? That commercial with the guy that has acne and he's like, maybe I ate too many chocolate bars.
yeah,
I think that one's the big
vaguely,
one
yeah, yeah.
that got people going on the chocolate bars.
Oh, no, chocolate does not cause acne. It does
No,
not. It
no,
can aggravate it,
total myth.
but just like any kind of sugar can cause glycation in the skin, sorry, bleh, and it can like increase your response to aging 100%. Um, but I think that there's so many of them. Like there's that, but I think that's probably the one main thing that I would say is that certain foods, unless you have an allergy or a sensitivity to the food, it is not causing
Yeah.
you to get acne. Acne is because your negative and positive ions within the cell are off. There's too many negatives versus the positives, and
And as we
that's
were
what's
talking about before too, like just because this food is good for you, it's considered healthy doesn't mean it's good for you. So the same
yeah.
thing with the chocolate, just because, somebody else is saying it's bad doesn't mean it's bad for you. Because
No,
everybody's so different.
everybody
So
is so
different.
different. Yeah.
Okay, that was a good one. I like it.
Yeah,
Uh,
I think that one is probably the biggest thing is just everything. And I've always said everything in moderation.
yes.
As a nutritionist, I still eat the Big Mac because why? Yes, it's not great for you, but I'm not eating it every month. I'm having it every 6 months as a little treat to myself,
Well,
right?
that's what makes you happy. Do it.
Yeah, exactly. Do
And
I
I
eat
had another
healthy?
nutritionist on that was saying food is energy. So what energy are you giving
100%.
that food?
Food is absolutely energy. You need, and we are malnourished, a lot of us. Surprisingly, people don't realize how malnourished some of our society is, and also with their supplements and their vitamins, how like deficient we are in certain supplements and vitamins too, right? So
Yep.
you have to just have a happy balance and get your energy vibration high and live happy. Don't allow others to affect you. And then, that stress component that you have in your life is completely reduced.
Yep.
And I think that that's, stress is a big thing for a lot of people, right? So, and I feel even more so today because of social media and this and that and, all kinds of things. So I think that people just need to get back to realizing that not everything
Not everything's,
needs
yeah.
needs to stress them out because it doesn't really have to do with them, right? Focus on you, focus on your health, focus on vibrating higher to bring more love into this world.
Yep.
God only knows we need it right now. So, I think those are really important and, making sure that you're healthy because whoever's around you is needing your good energy passed on to other people too. So,
Exactly.
yeah,
We leave a few minutes left. I want to try and get through two more questions.
for
So,
sure.
what is one thing that people need to stop doing in their skincare routine?
Teenagers using too many skincare products. Teens do not need retinols. They do not need glycolic peels. They do not need all of these things. They need simplicity in their skincare. They need sunscreen. Sunscreen is your number one anti-ager, guys. Please, please, please get your kid to wear sunscreen. I am a huge like if you look at my Instagram profile, it says SPF enthusiast. Sunscreen is huge, 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 huge. You know, I've been wearing sunscreen since a kid. I am whiter than white, as you can see, and I'm okay with that. A lot of people, even with my sister and my sister was the tanning bed lover. A lot of people used to think that I was the younger sister.
Yeah.
A lot of people look at my age and they're surprised as to how old I am, right? I probably kind of released it a little bit saying when I graduated and stuff, but I think that's a really important thing is sunscreen. Teenagers literally need a cleanser, maybe a toner, but most cleansers nowadays don't require a toner. They need a gentle exfoliant once or twice a week, and they need a moisturizer and they need a sunscreen. They don't need all of these peptides and ceramides and retinols and everything else. They do not need those.
Another
Those are
TikTok
going
thing.
to, yeah, they are going to cause their skin because teenage skin is turning over so rapidly
Yeah.
that they're actually going to cause almost like a scar tissue over, which is going to lead to premature aging. Please stop doing it. That is probably my number one thing that I see these teens show up with certain Sephora brands that I'm not going to mention, but they show up with them and they've got like 5 products, like just for the morning time. And I'm like,
No,
no,
no. My
these
routine isn't even that. I simplified mine so much and my skin's so much happier.
yeah, and and even with me as an esthetician and a skincare expert, I do not, if my client does not need 12 steps, I ain't gonna put you on 12 steps, let's be honest. Um, Now, in saying that, I'll put them on 12 steps and then I'll start removing things once we treat the condition
Yeah.
and we want to maintain, I'll start removing those products, right?
Yeah.
People don't need that. My routine's not 12 steps either,
Yeah.
right? Mine's a little more advanced, but it's not, I'm certainly not at 12 steps. I can tell you that right now. You know, but I think the biggest thing is sunscreen and stop using so many products because these kids are going to premature age.
Yeah.
100%.
Okay. Good advice. Good advice.
Yeah.
So we're gonna wrap this up now. So where can people find you? We'll put all of your contact info in our caption in the video so that people
Yeah, for
can
sure.
find you.
So located in Surrey, BC, and just in Cloverdale, and just
Yeah,
outside of the city center, the
perfect.
little town of city center. And they can find me at allysonobrien.ca. They can find me on Instagram and Facebook, both at AOB Wellness.
Awesome.
And
Awesome. We will link all that so everybody can find you. And if you want to go see her in Surrey for all your skincare needs, then absolutely. So thank you so much for coming on. We're going to wrap up this call and
thank
I'll see you
you.
guys again for another Ask an Expert Friday. Bye.